Hello, you guys. My name is Miguel Gomez, fellow Xray Tech student here, giving you information to help you through your medical X-ray program. And today we'll be covering how to handle or treat pediatric patients. So, depending on how small they are, and you'll learn this in school, you'll have to treat the pediatric patient differently to be able to get the exam done. So, for instance, and it always hurts my heart doing these little PD patients, the ones that are like barely newborn or preemies or like under 1 year old. These are slightly the more sometimes difficult and sometimes easy patients, depending. So, for instance, let's say you're going to do a newborn patient, like just barely born. So some of the things you'll have to take is you have to get the PD, like small image receptor. You have to make sure to reduce your technique by a lot. And once you're in there, and let's say you go to the room where the patient is, so usually mom or dad will be there. And sometimes it's better for them to be in there, they can help you, or sometimes the baby will act more frightened, more like act out when they're there, and sometimes it's better to have the parent not there. So you got to gauge the situation. But for the little ones, for the most part, you put the board, let's say they order a chest x-ray on them, and you put them down on the board, have mom or dad, always explain to them what's going on, how we're going to do this, because especially as if they're that small, the parents are always going to be super overprotective, and because it's their little baby, so you always got to make sure to talk with them, tell them what you're going to do, how they can help you. So if they're helping you, make sure they have lead, we have lead, and put a little gonadal shield on the baby to keep them safe. And ask the parents, like, let's say if it's a chest x-ray, make sure the parents hold like that little hand and try to hold them still so you can reduce the motion on the image, because the worst thing you can do is have to repeat an exposure because it's blurrier because you're cut anatomy, and especially being that small, they are very sensitive to radiation, so the less repeats you do, the better. In some cases, you'll have to use a pigostat, which I have not seen one, but they do say those exist, and with those are very scary devices, because sometimes they'll be looking like Jesus, they just be like this, and they look very frightening, and of course mom or dad, they'll be like, oh my god, my baby's crying, and you have to, sometimes it's best to not have them in the room. And sometimes make sure when you're putting, especially small little babies like that, make sure you put something over the image receptor, because it is cold. So like a little blanket or something over it, because it is very cold, and they're very sensitive to temperatures and stuff. So that's another thing. And try to make sure, if they're able to, sometimes it's easier to have mom give them like some milk or something to keep them calm. And then let's say they're a little bit older. They're between the 2 to 3 year old. They're slightly, it's not, I wouldn't say understanding, but they're semi more in control. So you can go in there, and some of them will be able to understand what you tell them a little bit. You have the baby talk them. You're like, oh, okay, we're gonna go over here. Have you sit down, lay down on your back. Some of them are more cooperative than others. And you have to, talk to their general range. And then if they're slightly more older, like between 4 and 5 and 6, as long as you get down to the level, talk to them, be like, okay, be honest with them. They're like, okay, this is what we're gonna do. Come over here towards the board, put your back, put your front, or we're gonna put a shield. A lot of them like stuff explained to them and being told, and some of them like even being guided when if they got to go to the image receptor, grab the little hand, take them with you, explain everything that's going to go on, and be like, okay, take a deep breath in, you're like, oh, hold it, and then breathe. And then always make sure, like, if they're doing a good job, like, okay, you're doing a good job, buddy, Do positive stuff, positive reinforcement. It'd be like, okay, if you're good. Like some departments have like little stickers, like we'll get a sticker if you do good. Like talk to them, try to, be friendly, be nice, be caring. Because, and always, if you're gonna do, like let's say you're doing a elbow, for instance, try to do all the easy, more simpler projections first. Because if you start off with the hard one and it's gonna hurt them, they're usually not gonna let you get the other ones. So if you start off with the more easier ones, and then save the last one for last, that's kind of better, because then some of the times they're very resistant and they don't want to perform the other exams. And sometimes parents, they help you so much. More dads, you'll be like, okay, we're gonna need his elbow in like this oblique position, and then they'll be there, like even if they're screaming or hollering or crying, the dad will do it. Sometimes with mom, they'll be more hesitant, they'll be more like protective, and they won't want to see their babies in pain just to get the image. So sometimes it's better not to have the mom there and have them step outside and actually get the stuff done. But overall, most PD patients will either go, they're very cooperative, or they'll be on the other aspect of they'll be like not cooperative, and you're gonna have to hold them down. And yeah, I hope that helps.